if you're coming into Medicare, you know by now that you have to make a lot of choices. You have to pick a plan that you're going to be on for your health insurance, likely for the rest of your life. And it's very important not to mess that up because it could be extremely expensive down the road, or you could have the wrong doctors or hospitals. You want to make sure you do it exactly right. And if you're coming into Medicare, you've seen any of my videos, you know I recommend that you stay on original Medicare, A and B, that you do not choose a Medicare Advantage plan. I certainly have a video or 2 or 5 on why I do not think Medicare Advantage is the right route. And it's important to understand that. But let's assume we already understand that. We're going to stay on original Medicare. Now we have to pick a supplement plan. So you've got 11 or 12 different choices, everything from A to G to F to N to L. And you want to make sure you get that right because it's a big part of that foundation of Medicare. And it's really not that complicated. I'm going to show you exactly right now why I would choose Medigap Plan G. And again, it's important to understand the differences between them. And when we're talking about original Medicare, and let me clarify for a minute. So on Medicare Advantage, you know, I get some pushback from some other people in the industry where they say you should offer everything. You should have everything. You should explain everything and let the customer decide what they want. And I have a different feeling about that. Under no circumstance, if I think of something that is absolutely terrible for somebody to have, I'm not going to explain, I'm not going to recommend it, I'm not going to give it as a choice. I'm certainly not going to sell it. And a main reason for that, outside of everything that I have in my videos, is the number of phone calls I get from people that are in medical situations where they are absolutely desperate to get out of their Medicare Advantage plan. And I don't want those kind of phone calls where I've put somebody into a Medicare Advantage plan, they now have cancer, and it's absolutely a terrible situation for what they're facing and they can't get out of it. So that's a main reason why I completely recommend original Medicare with a supplement, because you don't have any of that. You can choose any doctor, any hospital, go anywhere you want, do anything your doctor says you need. And that's exactly what I would want for myself, for my family. So that's why. So right now I'm going to talk about Medigap Plan G. Why would I choose Medigap Plan G? So if you've looked around, you know, in the old days, there was Medigap Plan F. And that was kind of the Cadillac. And there's a couple of reasons for that. It wasn't necessarily the best plan, but it was by far the most chosen because it was the most sold by insurance agents because it covered 100% of everything. There was no out-of-pocket cost once you had original Medicare and Medigap Plan F. 100% coverage, fantastic. But in the insurance world, that doesn't work so good because it promotes overutilization because there's no out-of-pocket cost to the consumer, so they use it when they shouldn't use it. So that's a whole different story. But anyway, Plan F is no longer available unless you turned 65 before 2020. If you did turn 65 before 2020, you could still get Medigap Plan F. But let's assume we're past that. And now what are our other choices? Well, here's our chart that I think are the really only 2 choices. There is a third one. I'm going to talk about that a little bit. But Plan G and Plan N are really our choices. So we're going to talk about Plan G right now. Why would I choose Medigap Plan G? Because it's fantastic. It's almost Plan F. And if you look at it this way, so you can see on the benefits here, Plan F covers 100% of everything. Terrific. Plan G covers 100% of everything, with the exception of the Medicare Part B deductible. And that Part B deductible is $226 per year, annual, January to January, $226. So if you get hit by a bus at any time during the year, it's going to cost you $226. And then your health insurance is going to pay 100% of everything else that comes along. Whether you got hit by a bus on January 2nd, it's going to cost $226. And then for the rest of the entire year, 0 out-of-pocket medical expenses. I mean, where could that be any better? Only if it were Plan F. So what you can look at is Plan G is Plan F. Once you hit that $226, it turns into Plan F. So it is absolutely fantastic cover. I mean, better than anything we've ever had coming into Medicare. Any work insurance or private insurance or anything before that, we've never had out-of-pocket expense of only $226 for the year. Now that Part B deductible does change every year, usually goes up a couple few dollars, $5 sometimes, $10 sometimes. Actually went down recently, so it is a little flexible, but it's not going to skyrocket to $2,000. So that is a very good bargain. Now, that being said, I wouldn't always buy Plan G. It depends on how much the premium is for Plan G. And in some states, it's very competitive. In some other states, for reasons I can't explain, it's not always so competitive. So if it is not any more than $25 above Plan N, I'm likely buying Plan G because, again, it just makes your life super easy. You don't have any thought about what things are going to cost in the future. If anything, the maximum is going to be $226, and then you're done with your out-of-pocket expense. So makes a very good choice. Now, that being said as well, understanding what I do and what we do at Medicare on video, and I still get calls where people say, oh, I didn't know you guys actually signed us up for things, and that's exactly what we do. So we make it easy for you. Number one, we'll find the right plan in your zip code, we'll find the right insurance company in your zip code, and we'll find the right price in your zip code. It's all about value. What is the best value where you are? And that's what we're going to focus on, the best value for you in your community. And a lot of people don't understand either. There's no additional cost for you to allow us to sign up. The way I get compensated is whatever insurance carrier we choose, they pay me a little to be your service agent now and in the future. So if you want somebody that hopefully you can trust, and I find myself very trustworthy, I hope you will as well. I will absolutely do what is in your best interest. And then down the road, if you need something, not only will you have my 800 number, you'll also have my cell phone number. And I answer my cell phone. And the reason I can do that, give my cell phone number, is because I don't get that many calls. I don't have problems that people need to solve. People generally, I've got thousands of clients and I just don't get phone calls with issues. So, but if you do need something, I will absolutely, if I don't answer on the first try, I will get back to you generally the same day and make sure that anything that you need is taken care of. So that's what we do. We try to make it as easy as we can. We try to make things as simple as we can. And then we will be there with you down the road, because there will come a time where we want to shop as well. So we always want to get the lowest price now, but we want to maintain that lowest price as we go. And sometimes we have to shop year to year, just like we do with auto insurance or home insurance or whatever it may be. So we do all that. We make it as easy as possible. Hope you find all this helpful. I'll show you how to download my free book. Make sure you do that. It's very important to have. Gives you all the information you need. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit medicareonvideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit medicarepricecheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be. And likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously Take advantage of all the information on my website at MedicareOnVideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.